Good morning. My name is Peter Gudaitis. I'm the Executive Director of New York Disaster Interfaith Services. And joining me this morning are Dr. Jennifer Rosen from the New York City Department of Health and Mental Hygiene, as well as my colleagues here at NYDIS, Susan Palevsky, who manages our COVID outreach project with the Health Department, and Gabrielle Sclafani, who's the program manager of our Faith Sector Community Preparedness Program. So I would just like to say welcome. Thank you for joining us and this important conversation that will include both some core information about the pandemic and its trends, as well as emerging information out of the Health Department and vaccine updates. As well as a conversation toward the end of the webinar about how faith leaders can be effective in communicating risk and vaccine updates to their congregations and constituent clients in community outreach programs. Slide. So over the weekend, it was reported, and I'm sure some of you have seen this information, that about somewhere in the 80% window, 85% of Americans must receive the COVID-19 vaccine in order to create herd immunity. I would stretch that a little farther and to say herd immunity in the United States still depends on herd immunity globally for global health, but that is a target for vaccination, obviously, in the United States. However, this is our challenge, and we can talk about the various reasons this may challenge us. Somewhere around 37 to 40% of Americans have doubts about the vaccine. Some of those may be strong convictions, like they're anti-vaxxers, or for religious reasons they don't want to take the vaccine, but that is a much smaller percentage than these folks who don't have confidence in the vaccine at the moment. And despite the research to the contrary, that nevertheless is what they think. So part of our conversation today needs to include facts about the vaccine and the research into its safety, but also acknowledging the history of how vaccines and inequities in our society, particularly racial inequities, cause doubt, not only in what the government might suggest, but also in whether or not the vaccine is being distributed in a just way. Slide. So here in New York City and throughout the country, I think it has been well established at this point that communities of color have been disparately impacted by the vaccine, by the pandemic. That means there are much higher death rates and infection rates in Black and Latino communities, as well as indigenous communities across the country. It is true here in New York City as well. Recently, Governor Cuomo made a pledge that he would not take the vaccine until communities of color had received it first. But that, of course, assumes that communities of color have confidence in the vaccine and will take it when it's offered. As you know, hopefully, if you do not, the governor and the state opened up Category 1B to the public, so people over 75, as well as other special categories of frontline workers. So that means, as of this week, people over 75 are eligible, for the vaccine. And the question remains, of course, what, as faith leaders, we can do to partner with the health department, with the state, to message accurately about the research, the availability of the vaccine, and encourage people to take it. Slide. Okay, I'm going to hand it over to Dr. Rosen, and the health department has its own slide deck that they're going to insert here, and we will continue the conversation following her presentation.
Great, thank you. And I think my colleague Anna is going to be putting up the slides. For those of you who heard me present last time, this presentation will include many updates as things are so rapidly changing. So again, the slide deck has been updated. And the other thing I want to add is, as part of the discussion that we'll have after, we really want to partner with important trusted leaders like all of you on the call in terms of messaging to community members, because we know people trust faith leaders. And so I wanted to mention that this slide deck, we can, I have to confirm, but I think we should be able to share it if someone from this group is interested in doing a presentation to community members. And if you're willing, I'd be happy to work with anyone in terms of reviewing the slide deck again, and recognizing that the slide deck gets updated all the time, and so we wouldn't want to share it today for you to use a month from now. But if you have a particular need for a slide deck, you can reach out to us, and we can work with you to either give you the same slide deck or some modified version that you can use. I think that's the most important thing we could do, is really help to share resources to make it easier for people to speak with community members. And to that line, anything that I say doesn't need to be memorized, because again, I think we'd be able to share these slide decks, but also more importantly, information here is also in frequently asked questions that are being developed and to be posted on our website. And so, Emma, I don't know if it's possible to just show the main slide, one slide at a time, because it may be hard for people to see. So today we're going to be talking about information on how on vaccines to help you better understand the COVID vaccine, how it works, and what to expect in the coming months. Next slide. Great. We know there are many New Yorkers who are still uncertain about getting vaccinated and who aren't sure if they can trust a vaccine to be safe and effective. Black and Latino persons account for a disproportionate number of COVID-19 cases, hospitalizations, and deaths. And disparities are likely related to a combination of factors, including structural racism, higher rates of pre-existing conditions, difficulties in practicing physical distancing, healthcare access issues, and other social determinants of health. Next slide. The Health Department is ensuring that equity is at the foundation of all aspects of the COVID-19 response, including regarding vaccine access. We need to address the longstanding mistrust of the medical community and government due to historical and continued mistreatment of people of color, immigrants, LGBTQ individuals, and other groups, especially as New Yorkers face the decision of whether to get vaccinated. So we're committed to gaining trust, combating misinformation, and ensuring free and easy access to vaccine for all New Yorkers. Next slide. Ensuring equitable access to COVID-19 vaccines will be accomplished by opening vaccine sites in communities that are most affected by COVID-19, ensuring language appropriate and culturally sensitive communication and outreach materials and at vaccination sites, partnering with community-based organizations and community leaders like yourselves, listening and responding to community concerns and input, providing up-to-date, accurate information about the vaccines, distribution, and access, including information about what we don't know, and monitoring data to identify gaps in access and enable a focused response. Next slide. These are some key messages about the vaccines and access that we want to make sure that everyone understands. So COVID-19 vaccines are safe and effective. They're free for everyone. They are available to people of all immigration statuses, and vaccination is not a public benefit under the public charge rule. And when people receive vaccine, their privacy will be protected. Importantly, we will not just say these statements, but will provide people with the facts and information they need to make informed decisions about vaccination, such as the information in this presentation about COVID-19 vaccines, how they were developed and monitored, how they work, and what to expect when you're vaccinated. Next slide. We'll start out by providing a brief summary of where we are in the vaccine rollout and more generally in the COVID-19 emergency. So on this slide, you can see that to date, over 190,000 people have received dose 1 of the vaccine, and 18,000 have already received dose 2. Next slide. This slide shows the current COVID-19 data for New York City, and as you can see, our percent positivity and cases are the highest that they have been since April. We're very excited about the promise of vaccines, but we can't throw the oars out of the boat just because we see the shore. We need all New Yorkers to continue doing what we know works to flatten the curve again. Next slide. And just as a reminder, we've heard this all before, this is what New Yorkers need to be doing right now to prevent the spread and flatten the curve. So even if after you get the vaccine, we need to continue these practices. So staying home if you're sick, keeping 6 feet apart from others, wearing a face covering, and washing your hands. Next slide. Next. Vaccines help people to develop immunity or protection from a disease so that their body can defend against the disease if they are exposed. Vaccines do this either by preventing people from getting the symptoms and complications from a disease, or by preventing people from getting a disease in the first place. And there are many different types of vaccines. Next slide. While vaccines protect the person who's being vaccinated, they can also protect the people around them and ultimately whole communities or populations. No vaccine works 100% of the time, and some people can't be vaccinated because of a medical condition or because of a vaccine that has not been approved for some groups, such as children. And so this is why it's important for as many people as possible to get vaccinated. For vaccines against contagious diseases, as more people get vaccinated, it makes it harder for a disease to spread, helping to protect even people who are not immune or protected from the disease. Next slide. When scientists develop an idea for a vaccine, they first test it in a lab, and then if the lab tests are successful, they can enter clinical trials, which means testing the vaccine in volunteers. Next slide. So briefly, there are 4 phases of vaccine clinical trials, and each phase studies whether the vaccine works and whether the vaccine is safe. In phase 1 studies, a small number of people get the vaccine. In phase 2 studies, the study size increases and several hundred people get the vaccine. Phase 3 studies typically include thousands of people who either receive the vaccine or no vaccine, so that's called a placebo, and then they compare the 2 groups. And ideally, the people in the studies have characteristics like age or health conditions similar to people who will ultimately receive the vaccine if approved. After a vaccine is approved, scientists may continue to monitor its safety and how well the vaccine works during phase 4 studies. And in this way, they will quickly become aware of any issues so that vaccines can be halted if necessary. Next slide. Vaccines must be reviewed by the US FDA before they can be used. And with vaccines, the FDA has a very high level of involvement. So it monitors vaccine development from beginning to end, analyzes clinical trial data to decide whether to allow the vaccine to be used, and they continue to monitor vaccine safety data even after the vaccine is approved. Next slide. In an emergency, the FDA may allow vaccines to be used before they are officially licensed by issuing what's called an emergency use authorization, or an EUA, so that we can start using the vaccine right away. And importantly, this does not mean that shortcuts were taken. In fact, all vaccines issued an EUA must go through the same clinical trials as all other vaccines. An EUA can be issued only if the evidence strongly suggests that the benefits outweigh any risks to patients. Next slide. In addition to the FDA, several other federal agencies and external organizations monitor vaccine safety during trials and as part of ongoing evaluations after vaccines are approved. Next slide. Development of COVID-19 vaccines has involved unprecedented resources. Billions of dollars have been spent, and hundreds of scientists around the world have been working on vaccines nonstop. Next slide. In developing COVID-19 vaccines, scientists build on many years of research from other vaccines, including research on vaccines for other coronaviruses. Also, the federal government provided special funding to allow development, testing, and production to happen at the same time. For example, companies could start manufacturing vaccine even before they were done studying them. And this is not usually done because if a vaccine is not approved, they would have wasted millions of dollars producing something that now they need to throw away. Also, the federal government, state, and local health departments and healthcare providers have been working for months to plan for storage, distribution, supplies, and other logistics. Next slide. 2 vaccines have been authorized by the FDA for use. Last week we started to, we've started to administer the Pfizer BioNTech vaccine, and now we're also using the Moderna vaccine. Both are mRNA vaccines, and I will explain what that is in a moment. There are several other vaccines still being tested in clinical trials, but they're in various stages of testing. Next slide. The 2 COVID vaccines that are available are Pfizer and Moderna. As mentioned, both are messenger RNA or mRNA vaccines. mRNA vaccines contain genetic material from the COVID-19 virus. And so what's mRNA? mRNA are molecules that provide instructions to the body. And it's important to understand that while mRNA is a new type of vaccine technology, it's actually been studied for over 30 years. And so here is how the vaccine works. Think of it as like an email sent to your immune system, and the email has instructions about what the virus looks like and how to kill it, and then the email gets deleted permanently. So the mRNA is destroyed quickly, it does not stay in your body, and it does not affect or interact with a person's DNA. Next slide. From clinical trials, we know that the Pfizer vaccine has 95% efficacy at preventing symptoms of COVID and decreasing your chance of having severe infection. This means that more than 9 out of every 10 people vaccinated during the trials were protected from disease, and this is really incredible. This is very, very high for vaccines. And just for reference, the FDA requires vaccines to be at least 50% effective, and obviously this is much higher. Importantly, the vaccine worked well in people of different ages, gender, race, and ethnicity, and no serious safety concerns have been found with this vaccine. Similar to the Pfizer vaccine, the Moderna vaccine has demonstrated to have high efficacy of 94.1%. This means that more than 9 out of every 10 people vaccinated with this vaccine during trials were protected. And just like with the Pfizer vaccine, the Moderna vaccine worked well in people of different ages, gender, race, and ethnicity, and no serious safety concerns were found. Next slide. So what's the difference between the 2 vaccines? They're actually pretty similar. So as mentioned, they're both mRNA vaccines, both have very high efficacy, both require 2 doses, and both can cause mild to moderate side effects, which I'll discuss a bit more later on. A key difference is that the Pfizer vaccine was approved for use in people aged 16 and older, but Moderna only for people aged 18 and older. Other than that, really the main difference just has to do with how the vaccines are stored and distributed. The Pfizer vaccine needs to be stored in much lower temperatures and must be used more quickly once they're thawed, which impacts where it is available because not all places have these special ultra cold freezers to store that vaccine. Next slide. As good as the clinical trial results are, there's still a lot we don't know since these are new vaccines. Importantly, we are confident that the FDA-approved vaccines are safe, but we're not certain about certain other things that take more time to study, and this includes how long immunity or protection from the vaccine will last, whether additional doses will be needed in the future, whether the vaccine is safe and effective for children, whether being vaccinated prevents people from spreading the virus to others, and what other vaccines might become available in the coming months. Next slide. Now I'll talk about how the vaccine will get distributed. Since there's not enough vaccine available all at once, vaccine is being distributed in phases, and the CDC's Advisory Committee on Immunization Practices sets guidance for the country, and New York City and New York State's plan is based on these recommendations. This approach that we're taking to phased distribution of vaccine will be rooted in equity and will prioritize people who have been hardest hit by the pandemic. And while we still have some details to work out, we know the basic groups of people that will be prioritized for vaccine first. And in general, the people that are being prioritized fall into one of two categories. They are either at increased risk of exposure to COVID-19, or they're at increased risk of having severe disease if they get it. So people who work in high-risk healthcare settings like ICUs or emergency rooms, and residents of long-term care facilities and staff were eligible to receive vaccine first, along with first responders and medical roles. And recently, additional populations have been made eligible for vaccination, including most healthcare workers, medical examiners, coroners, at-risk funeral workers, and frontline public health workers with patient contact. And we expect that essential workers who can't physically distance and people at high risk for complications from COVID-19 because of underlying conditions to be prioritized. Next, currently people age 75 and older are eligible, as well as many additional groups as part of phase 1B. So the next slide, the phase distribution will take time, and we don't expect vaccines to be widely available until mid-2021. And people in the highest priority groups are already getting vaccinated, which is very exciting, but we still have a long way to go. New York City will receive additional vaccine on a weekly basis, and the exact numbers are decided by the federal government based on availability, number of people needing to be vaccinated, and other factors. The health department oversees vaccine distribution to ensure that healthcare providers throughout the city have access. Okay, so now I'll talk a bit more about getting the vaccine. Next slide. So first, why should you get vaccinated? Well, for starters, it protects you from COVID, no matter what age you are. COVID can have some very serious consequences. So even if you had COVID-19, it's important to be vaccinated because it lowers your risk of getting it again. And second, getting vaccinated may protect those around you, particularly people who can't get vaccinated and people who are at higher risk of complications from the infection. And third, vaccination, along with other prevention measures, is how we can help end the public health emergency. The first thing to note is that the vaccine will be available at no cost to everyone, whether or not you have health insurance, and it's available to everyone regardless of immigration status. Vaccines will not be available initially for children, and this is simply because the vaccine was first tested in adults, and the information that we have about safety is primarily based on trials in adult populations. Some groups, like pregnant and breastfeeding people and people with certain health conditions, were not included in the clinical trials, or they were included but in small numbers. And because of this, there is limited data as to vaccine safety and effectiveness in these groups. These groups can still be vaccinated, as based on other available information, experts believe that the vaccine is likely safe and effective in these groups, but people in these groups should speak with their healthcare providers if they have questions about whether the vaccine is the right choice for them. The city has started opening vaccine sites for eligible populations only, and the city sites are by appointment, and our website is nyc.gov/COVID vaccine, and there you can get information on who is eligible for vaccine and where they can get vaccinated. The eligibility groups is rapidly changing and is dictated by the state, so the website is really the best place to go for the most up-to-date information. Once the vaccine is made more widely available, you should expect to be able to get the vaccine at the same place as you usually get vaccinated. This could be at your primary physician's office, community or hospital clinics, pharmacies, or urgent care centers. The health department is also standing up mass distribution sites to make sure that there's adequate access to vaccine throughout the city. So stay tuned to the website for more information. It will be important that you have a plan to make sure that you receive the needed second dose of vaccine. The vaccine offers some protection after the first dose, but protects you much more after the second dose. The second dose should be the same vaccine as your first dose. For example, if the first dose was Pfizer, the second should be Pfizer. And the vaccine is, optimal protection from the vaccine is 1 to 2 weeks after the second dose. The schedule for the second dose is slightly different depending on which vaccine you get. So if you get Pfizer vaccine, the second dose should be given 21 days later, whereas if you get Moderna, the second dose is 28 days later. When you get the first dose, you'll get a proof of vaccination document, which lists the vaccine you received and the dates you received it. Bring this card to your second appointment so that the second dose can be marked on the same card. Most people report some side effects from the vaccines, which are normal signs that your body is building protection. Common side effects are soreness or swelling on the arm where you got the shot, headache, body aches, and tiredness. And you may also have a fever. Side effects are usually mild to moderate, and they start within the first 3 days after getting the shot, with the day after vaccine being the most common. Side effects last about 1 to 2 days after they begin, and they're more common actually after the second shot and less common in older adults. If you have any concerns that your symptoms aren't improving or they're worsening, of course, you should contact your medical provider. And it's important to highlight that these side effects are normal. You cannot get COVID-19 from the vaccine. Next slide. Okay. So as mentioned, if you have side effects that bother you or don't go away after a few days, or if the redness or soreness where you got the shot increases after 24 hours, contact your provider. And if you do develop symptoms, you can also talk to your provider about taking an over-the-counter medicine like Tylenol or Advil to relieve pain or discomfort. Very importantly, you should still get the second shot, even if you have side effects after the first shot, unless your healthcare provider tells you not to. Next slide, based on what's currently known, serious allergic reactions are very rare. Talk to your provider if you previously experienced an allergic reaction to a vaccine or an injectable medicine, or if you are allergic to any of the ingredients in the vaccine. You should receive this information when you go for your vaccine. People with a history of severe allergic reactions not related to vaccines or injectable medications like allergies to food, pets, venom, environmental allergens, or latex, they can get vaccinated. And also, we need to distinguish between allergic reactions and side effects. Allergic reactions generally start within a few minutes to an hour after getting the shot. That is not expected and not normal, as opposed to what we described as redness, soreness, swelling on the arm where the shot was given, feeling fatigued, or having a fever. Signs of a severe allergic reaction can include difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, dizziness, and weakness. So again, that's not normal. Next slide. Stay vigilant even after you're vaccinated. You still need to practice the core 4 prevention measures after vaccination. So what we mentioned before, staying home if you're sick, keeping 6 feet distance from others, wearing a face covering. And this is because, as mentioned before, although COVID vaccines have been shown to be very effective, it does not work for everyone. No vaccines are 100% effective. And so we need to continue to protect ourselves and the people around us. Also, we still need to learn more about how long vaccine protection lasts and the impact of the vaccine on disease transmission. The agency will let all New Yorkers know when it's safe to stop wearing masks and social distancing. And so I'll end with our final slide. There's a lot of misinformation about vaccines. Take the time to learn about the vaccine from trusted sources like your healthcare provider, the CDC, and the health department. Vaccines are safe, and the COVID-19 vaccines have undergone the same level of robust analyses as other vaccines. Tens of thousands of participants in clinical trials have safely received both Moderna and Pfizer vaccines, and at least 30% of all clinical trial participants were people of color. As more vaccine is rolled out around the world, we're going to continue to have more data and information every day. When it's your turn to get vaccinated, it will be easy, safe, and free from barriers such as cost and immigration status. Thank you. And we have some resources on the next slide. So thank you, and I am happy to take any questions.
If you have any questions, feel free to put them in the chat or to unmute yourself.
So there's a question about making the presentation available. So Jennifer, you will send this to us as a PDF that we can share with participants?
Yeah, I think the first question is, are there people on this call who are interested and willing to do the presentation? And I will need to speak with my colleagues, but yeah, if there are people that are interested, I would like to be able to facilitate that. It would be sent as a PDF. However, there is also a script, and that might help people feel more comfortable, so we can also make sure that a script is sent as well. So are there people on the call who feel that they would be willing to do a presentation like this to their community members? And we also have staff who are available to do presentations to community groups, but I certainly think new messaging coming from all of you as the trusted leaders would be the most valuable.
So I know some of you represent organizations like COADs, and others of you represent congregations and faith-based nonprofits. So we will record your responses in the chat and contact you if you are interested in doing presentations for your own organization or members. So please either put your information in the chat or feel free to email Susan Palevsky requesting an introduction to DOHMH so that you can provide the slide deck in your community.
Great, and I think that probably is a good way to go in terms of before sharing it, let's, when someone's ready to do a presentation to reach out to DOH. That way you're also getting the most up-to-date version of the slide set. Again, it's being updated probably on a daily basis.
Nuts and bolts, practical issues, paying bills.
Thank you so much, Dr. Rosen. Are there any specific questions for Dr. Rosen about the content that anyone would like to ask?
Yes, hi. This is Dennis Johnson. I was wondering, I just heard or read that the Secretary Azar, HHS Secretary Azar, is announcing that the feds are releasing the balance of the vaccine, that whatever they still have, and are recommending states immediately vaccinate those 65 and older. Does that change anything relative to what you just presented?
At this moment in New York, the population's eligible. It's still 75 and older, but things are changing so rapidly, and so if and when the eligibility groups have expanded, it will be on our website. So I do encourage people to continue to check the website for the list of eligible groups. Just to reiterate, we in New York City have to follow the requirements of New York State.
So I have a comment to make. This is Io from Elias Ready. So the presentation gives people basic education about the vaccine, the trials, and the intent of the Department of Health in the city. But what it doesn't include, which I will suggest, and this is not my first time seeing such a presentation from a member of the Department of Health, is the commitment to equity with regard to distribution is not in this presentation. So if I am doing a presentation to someone in my community, I can talk about my personal experience and how I feel about it and what I think the city is doing. But unless I'm seeing something in writing from the city about specifically what they are doing to cause equitable distribution of this vaccine, I don't think communities who are hesitant are going to buy into it. They're going to be asking the presenter, how do you know this? How is it being done? Why am I not seeing it in my community? So I think it's really important to for the Department of Health to ask themselves how they're doing it and to translate it into this present and all of your presentations.
Sure, and I think that's really important feedback. Maybe the information that we have is too general. We do have a slide on ensuring equitable access and so things like opening vaccine sites in communities most affected by COVID-19, language appropriate and culturally sensitive communication and outreach, partnering with CBOs and community leaders, for example. But I think part of the issue is that vaccine is not as widely available yet. It's been very specific groups until basically Monday. So, but I think that's great feedback. And in terms of work that is already being done for special populations, I think we need to add that and add more detail about specific plans. I know one big area is, again, making sure that there's widely available access by opening up the additional vaccination sites. For example, 15 new sites have been opened, and but
so not to cut you off, but
yeah.
Maybe if in the presentation examples of what is happening around the city specific to communities might be helpful. Also, the word underlying conditions has been of great concern to many communities. What does that mean? Specifically, does it mean that people who are HIV positive are in that definition, or people with other medical conditions? It's just so general and so vague. People don't know whether or not it applies to them, and I think that's all the feedback that I might have for this presentation.
That is excellent feedback. I have to admit that I've had the same question, and I think the issue is that that's also something that will be coming from New York State, that we don't have all the information, but either way, if that's the case, I think we need to specify that up front, that those conditions are still being determined, or if they have been determined, and I'm not correct, if it actually has been determined, I think that's a great point. We should add that. So great feedback. And if others have more feedback like that, that's exactly what I'm hoping to get from all of you, how we can make this presentation better and address people's concerns and hesitancy.
Dr. Rosen, this had come up after your last presentation, but the mayor had committed to concentrate vaccine distribution sites in high infection zones of the city. That in part is to address racial inequities. Is that true?
Yes, that is true. And so there are many sites that have opened in the past few days, given that now the eligibility groups have increased. And so, for example, 15 additional Department of Health sites have opened, and all of the sites are listed online, and the intent is to reduce inequities and make sure that there's better access to vaccine in communities that have been hardest hit.
I'd also be curious if the city will be transparent about the success rates of vaccination in communities of color. So is the city going to be releasing data on where the vaccine is successfully being rolled out, and are communities of color getting equitable access? I just think that transparency is important for building confidence.
Yeah.
That the process is not just window dressing, but it actually is working.
Definitely. Very important point. And yes, the answer is yes, the Department of Health will be closely tracking that, and data is being posted on the Department of Health website. And in terms of outreach and work that the health department is doing, the agency will be very closely tracking areas where vaccination rates are lagging behind, so that outreach can be tailored appropriately.
Any other questions for Dr. Rosen before we move on?
I'd just like to make one last suggestion, Peter, if that's okay.
Sure. Please.
Okay. So in addition to offering this slide presentation to help people within specific communities make presentations nuanced to the needs of their community. This is kind of an aside, but it's and kind of a visual, and I've said this in other meetings, the Board of Elections hired about 5,000 people to be line managers during the early election. Those line managers were very, very effective. They were hired from the communities in which they lived. People waited in line for hours and hours, as they might be doing with the distribution of this vaccination. But people in line actually saw people who lived in their community down the block, people they saw in the supermarket. This is already a group of people who have been trained in line management, and it would make perfect sense for the Department of Health to actually access this existing workforce from communities to do the same with regard to vaccine distribution. People who are walking by might see, Jane, who they know, talking to people standing in line, and might, encourage them to consider, if they're reluctant about the vaccination, getting it. So it's just, a recommendation that actually came out of VOAD.
Oh, I think that's a fantastic idea, which I will definitely relay. We're working closely with City Hall. We have a vaccine command center that's staffed with both DOH and City Hall agencies, and I think that's exactly the kind of information that they're looking for. And if you think of any additional ideas, I know you all probably have Anna's email, but I'll give you my email as well, or she can forward information to me. But my email is jrosen, ROSEN 4 @health.nyc.gov.
Can you put that in the chat, Dr. Rosen?
Oh, sure.
Thank you.
And any other suggestions that people have in terms of what, aside from increasing messaging to communities, how we can have better discussions, whether it be revisions needed to this slide set, or just for people who are working with communities, how we can better have discussions, I would greatly appreciate.
Yeah, I have one question before we part. Can you hear me?
Yes.
Brother Joseph from Back to Eden Radio, I appreciate the sensitivity to the equity of distribution, and y'all recognizing the history of fear that a lot of communities of color have about the vaccine. But one of the things you mentioned that everybody talks about are the side effects, and everybody's pretty much acclimating to the fact, it seems, that there will be some side effects. But you mentioned today the allergy, the distinction in the allergies and the side effects. And the allergy component, we're dealing with breathing, facial swelling, heart racing, etc., which seemingly would be of things of major concern. Are there any, do you have any data on how severe the allergy side situation is, and what's been the follow-up in that area with people who have had severe allergies beyond the regular good old day-to-day side effects?
Yeah, thank you for mentioning that. So there have been reports of people with serious allergic reactions to the vaccine, but relative to the number of people who have actually received vaccine, it is still a very rare event. So as of about a week ago, there were 21 people who had had serious allergic reactions, and that comes down to a rate of about 11 per million people vaccinated. So again, still very rare. That being said, concerning, and so there are safeguards in place. So people who are offering at vaccination sites, there are screening questions to ask about risk factors that would put people at a much higher risk for having a reaction like that. So people who have had anaphylaxis, breathing problems before from an ingredient in the vaccine or from a shot, that would be screened for. And the other important thing is that, so these serious allergic reactions are treatable. They're very treatable. And so people who are providing vaccine, after getting vaccine, people have to remain at the site for 15 minutes for observation. Or if they have certain risk factors, they have to stay for 30 minutes for observation. That way, if they develop any symptoms, they can be treated.
So there's no sustainable concern for severe allergies that that could be irreversible in some way. That's not a valid concern of the day, is what you're saying.
Well, it's not like people would have allergic reactions that go on for like many weeks or any, not like that. That being said, the allergic reaction can be very serious, but it's something that should be treated immediately. And if people need additional observation, then they remain in a medical setting to make sure that the reaction has been completely treated appropriately.
The final quick question I'll just say, is the Department of Health making any specific efforts to target the faith-based communities of color, Black and brown, if you will, with the information beyond these Zoom conferences, which are wonderful, and I appreciate what Peter is doing with this. But is the Department of Health making any specific entrees into getting to the faith-based communities of color?
So we do have a liaison at the health department who is working with faith-based organizations, and so there are other organizations that are we're working with as well. And the outreach largely consists of meeting with trusted leaders to get information out. But if there are other ways that, aside from speaking with the leaders and doing the trainings and sharing materials so that leaders can speak with community members, if there are other specific things that we can and should be doing, I would love to know any suggestions that you have.
Thank you.
Sure.
Thank you all for your questions. We need to move on, but first, thank you, Dr. Rosen, for joining us today and for your information. I quickly want to point out some slides that are going to be made available to you when the slide deck is sent to all participants, specifically about what we call CIRC, or Crisis and Emergency Risk Communication. That's just kind of a fancy term that I don't want anybody to worry about too much. But when we're talking about the need for 80% uptake for the United States to reach herd immunity, we have to recognize that about 24% of our population is under 18. So for the United States to get to 80% herd immunity, virtually all adults have to be vaccinated. So we need to think as community leaders, as you all are, either leading your own congregations, organizations, or networks, what can we do to communicate to communities accurately about the vaccine and share the risks, because we should never hide the risks, but that we build confidence. And the other challenge that we face for those of us that are not people of color, as advocates for communities of color and racial justice and equity, are we educating our congregations about the higher risk for communities of color, and are we advocating for communities of color to have access to the vaccine before us, whenever possible? We must look to the high-risk populations as advocates to make sure that the most vulnerable get access to the vaccine first. But we also have to accept that racism and the history of inequities in the United States are preventing communities of color from trusting the vaccine. And so getting accurate science out, making sure communities of color understand that they often are in higher risk locations, as well as inequities in access to medical care. All of those things are barriers. And we can't change the world individually, but we can certainly share facts. We can certainly model the importance of talking about racial justice and equity in the vaccine distribution as well. Frontline workers, I would never advocate that frontline workers are not get vaccinated. That's not what this is about. This is about, as the vaccine rolls out to the general public, which we are now in, obviously, as we're in 1B, how are we working as effective allies to ensure equity in distribution, and how are we sharing accurate information with vulnerable communities? Next slide, please. So this is a metric that I hope that you will consider when you're thinking about sharing information about the vaccine. Never assume that people are getting the information or that they're getting accurate information. I'm sure that you will agree with me, because just because it's on the internet doesn't mean it's accurate. So we want to make sure we're sharing information from health departments, from the CDC, not sort of general self-appointed experts on social media. You want to get information out quickly, so be first. Be sure your information is accurate, as I said, that it's confirmed by public health experts. And by that, I mean public health agencies, the Department of Health, the CDC, not somebody who calls themselves, Dr. Internet. Be credible, express empathy, and promote action, show respect. Expressing empathy is part and parcel to a conversation about justice and equity. We have to be empathetic for the higher risk that is placed on the Black community first, right? So Black Americans die at twice the rates of white Americans when infected. Latinos about 1.5 times higher than white Americans. Asians and white Americans are in a similar risk category. So we have to share that information so that people understand why conversations about vaccine equity are important, and that they are based in facts, not political correctness, if you will. Promote action, that we encourage people to get the vaccine, and whenever possible, that we share the fact that we've got the vaccine and what our experiences are. So for instance, I had COVID in March. I always share what my experience was like so people understand what they might expect. I think for those of us that are leading organizations, it's important for us to model getting the vaccine, sharing our experience of the vaccine. The research on the Pfizer vaccine, for instance, showed that only about 6% of test subjects had significant side effects. So we're not talking about half or 80% or 90% of people getting side effects. So looking at the research matters, and show respect. The internet is a place, as you all know, that is full of hate and vitriol as much as it has access to accurate and helpful information. We want to demonstrate as faith leaders respect for the decisions being made that prioritize highly vulnerable communities first and highly vulnerable populations first. It is important that we don't participate in any of the negative discourse that happens in social media about these decisions. These are medical decisions, right? The people most vulnerable have the earliest access to the vaccine. Slide, please. The other thing that I want to emphasize is that we suggest communicating on all of these topics in a timely manner and never assume that the constituents that you communicate with are getting this information first. So sharing information about vaccine availability, the updates change often. Even though the governor released the 1B list weeks ago, categories of people have been added to the 1B list since it was released. So just because somebody saw the list 2 weeks ago doesn't mean they know who's on the 1B list today. So things change, and we want to keep updating people on who can access the vaccine and how. To be timely, you are all aware, I'm certain, of the new strains of the virus that are more infectious, not more deadly, but more infectious. Make sure your congregation and your congregation members, your clients, your staff know what risk zone they are in. Are they in a red zone or a yellow zone that has higher infection rates? And do they know how to find those zones? And we'll show you that in just a minute. If there are confirmed cases on your staff or in your congregation, to be transparent about that. People have a right to privacy, obviously, not sharing someone's name unless someone's been exposed to that person, but letting people know that there has been an infection. When there has been a death in your congregation or severe illness, expressing empathy for that family and support. Protocols for safe in-person gatherings when they're permitted, and paying attention to the governor's press releases and informed about research finding, again, research by reputable organizations confirmed by the government. Slide, please. You can slide. Pay attention to what platforms you're using for communication and be sure your congregation knows to follow that platform. If you communicate most through Facebook or most through Twitter, that they know that, or if you do that through email, that they know that. So making sure they understand how you're communicating and not assume people know where the most recent information is. And that when you have somebody who writes messages, that they will follow these guidelines about how they write messages. We never want to scare people, but we do want people to understand the risk factors. Has your congregation begun vaccine communications? And if you haven't, please consider doing that now that we are in 1B of the distribution list, which again includes members of the general public over the age of 75. Another category that wasn't mentioned in the DOHMH slide deck is that anyone working face-to-face with those who live on the street or in congregant housing like homeless shelters, including paid staff and volunteers. And when the guidelines refer to staff, the guidelines are referring to paid professional staff and volunteers. Volunteers are considered staff in any of these categories of providers. So for instance, EMTs, emergency medical technicians qualifying doesn't just mean paid NYPD EMTs. It means EMTs that work with volunteer ambulance services as well as professional. So professional homeless services staff as well as volunteers. And then obviously we want you to share information about risk communication practices so that people that pass your information on also understand the importance of how the messaging is structured. Slide. Excuse me. A best practice is to form a team who communicates so that there's never a period of time that there isn't someone who's able to communicate on behalf of your organization. You know, a senior staff person going on vacation for the weekend doesn't mean urgent information is going to stop flowing and won't need to be shared. Encouraging people to get the vaccine and sharing their examples, again, is very important. There are going to be people who have doubts about the vaccine. You have seen the statistics. They're certainly worrying. So hearing, particularly in communities of color, that leaders within the community or members of the community have taken the vaccine and what their experience of the vaccine has been are important confirmations of the vaccine's safety, but they're also realistic about what the side effects might be. Slide. This is your choice, obviously, who are trusted get the vaccine, like President-elect Biden has, and take a photograph of them getting it and offer testimony. It does instill confidence. So I know that Staten Island COAD is doing a campaign asking community leaders to photograph themselves getting the vaccine and using a hashtag to demonstrate that that there's uptake. That might be something that you want to consider for yourself, posting a picture of you getting the vaccine or others getting the vaccine who people within your congregation or organization trust. Slide. So this speaks to that same point. We are over time. I apologize for that. I wanted to get through a few of these slides emphasizing the importance and accuracy of risk communication. And I want to again reiterate the importance of leaders who are outside of communities of color in the city talk accurately about the need for an honest discussion about equity in the vaccine's distribution, and how you express yourself as an ally will build confidence and education amongst those who don't understand why it is important that communities of color are prioritized and at the very least have equitable access to the vaccine here in New York City and around the country. So I thank you for your time. Again, I apologize that we've gone over, and I hope that those of you that are interested in getting access to the slide deck from the health department have shared that information with us, and that is something you can connect with Susan directly on, and we will make sure that everybody gets their email shared and gets access to that slide deck if available. If anybody would like to stay on a few minutes, we'll turn off the recording and ask some questions. I'm happy to stay. Otherwise, again, thank you for joining us this morning, and thank you to Yeshi and Jennifer and Anna from the Health Department for joining us this morning.